Am o mare onoare astăzi, un oaspete pe care întreaga Românie îl cunoaște de departe. Astăzi e alături de mine domnul profesor dr. MEHMET MUTAF. Este omul care îi schimbă pas cu pas viața lui Alex, băiețelul despre care știți. O Românie întreagă a urmărit cazul lui. Mulți români au strâns bani pentru a-l ajuta și au fost atât de generoși. Acum băiețelul urmează în trepte operații succesive prin care corpul său, după incendiul ce i-a schimbat viața în rău, din păcate, corpul său este reconstruit, să spun așa. Cred că sunteți cu toții curioși să aflați direct de la omul care acum câteva zile a făcut deja prima intervenție chirurgicală la Acibadem, Bodrum, pentru Alex. Să știți care e starea lui astăzi. I'm honored to have you in front of my micro.
To meet you.
And I'm happy you are today in Romania. You didn't come this time for Alex. Alex came to you a few days ago and you made already the first surgery for him. Before I will ask you, what did you do today here in Acibadem Representants in Bucuresti? Because other Romanians came to see you and let's say it straight. You put it your time, your experience, free of charge, at their disposal.
Pleasure.
Yes, thank you very much for this. On the other hand, we want to know news about little Alex.
Alex, yeah. Alex boy is doing well. I have very good news to you. As you know, I made the first stage of surgery at 26th of last month, and it's about 7 days ago. And as a natural result of surgery, we have some edema and swellings around the eyelids, because in this stage we recreate the eyelids in the nose area and as well as the corner of the mouth and upper lips. So that was our purposes in the first stage. And we did all, but at the end of 12 hours of operation with a patient who is 2.5 years, we faced lots of risk and made lots of different new decision makings during surgery. But at the end, we are happy to announce that Alex is good and playing with the nurses. Turkish people in love with Alex too, as well as Romanian people prayed for Alex. Turkish people also knew about him and following news about him. And Alex boy, I think, will be a bridge between our nations, bridge of love and empathy, understanding.
Thank you
That's
very,
great.
very much for your disponibility. And in the same time, I cannot stop myself to ask you how his young parents resisted to this hard experience.
They are adorable, amazing parents Alex have. Because as you said, they are pretty young, to carry this much of, painful experience. But they are resisting good, believe me. We are also trying to give them support, but the main problem is language barrier again. We have a translator, a Romanian guy. He is helping us to understand each other every day he's visiting.
I observed something very sensitive in the photos made there in the hospital.
Yeah.
Alex entered in the surgery room, staying on his mother's body like this. And after the first visit you had in their room, they were the same.
Sure.
The child staying on his mother's chest. This human gesture, it's so touching. And I want to ask you how you adapt yourself, your rules, which are medical, strict rules, to the situation. Because, in a case like this, I think this child needed more than everything the love of everybody around him.
Yeah, I mean, I could explain like that, you know. As at the beginning of this interview, of course, we talked a little with you, not in front of cams, but I mean, personally. As you know, I'm a father too. And not only as a doctor, I mean, who have lots of experience with children or pediatric patients. As a father, I know the, emotions and I'd say needs of children. And we adapted this to our practice. In our institution, in Dr. Mutaf International Clinic in Acibadem, Bodrum, every children, have the same treatment, not only the Alex. This helps the children to feel safe, and they are crying less, fearing less.
And the process is easier, I think, for you?
A lot, but before this process, we educate the parents in a while, you know, just telling them what kind of things will be gonna happen. And before surgery, we are giving them a sweet drink to make them relax, children, and that helps a lot for the mothers and the children. In Alex's case, I have to say, at the beginning, for example, at first sight, we were in love with Alex. He was playing with me and making me give me 5, and he's responding me. Let me to say something more about Alex's situation. Today, first time, he opened the eyes, and this is a big, I'd say, advancement and good news for us. Because of the swellings in the last 6 days, he was not able to see around. So this will help him and us to communicate. For example, last Sunday, I brought my children to visit him.
How old?
My son is 6 and my daughter is 4.
Oh, bravo.
So quite, near. And my children went there with an, I would say, will of playing with Alex, or, giving some relief to him.
I know you from somewhere, and I was trying to search in my mind and to understand where do I know you from. And now I know. Before being a doctor, you were an artist.
True.
Can you tell us about this? This is not happening too often in this medical field.
I say maybe making music professionally, and on the other side being a plastic surgeon or scientist. Yeah, it's not a common case. But in my life, it has been. These two things been together always. From university years, even high school years. I've been the boy who plays and sings for every occasion, for everybody. I'm in love of music, still, going on. And it was about, years ago. I did something professionally about music. 3 albums released and sold out very good, over 1 million copies. And those days I was very famous,
Yes,
not as you
know.
are today, but yeah, I knew the feeling. Being famous or celebrity in my country, of course.
But now you know the feeling of saving lives, which I think is
those days also
much
I
important.
was a doctor, but at the end of success in music, I figured out that my father especially was not happy about what I did. He was disappointed because, he talked to me like that. Come on, I sent you to university because I wish you will be the best doctor, not a singer. I worked for you. I earned the money and, spent my money for you, for your future. And honestly talking, I'm not happy about the result. That was the talk of my father. He died 2 years ago. And yeah, I accept his opinion. at the end, and I quit music. I'm a professional part of music. I'm still writing songs a lot, and decided to make progress in my medical career, and I then became 9 years ago. I became professor before he dies, and then we talked again.
He was happy.
Yes.
In that time, isn't it?
And I said, "Did I pay?" He said, "Yes, son, you paid a lot."
And you really know the success now in medicine. I have in front of me your CV. There are just some words.
You know everything about me. This is very dangerous.
I don't know if it's everything, but what I know, and I think it's very important to say this, is that you made over 20 original surgical techniques. You simply discovered new medical techniques in your field. I think this is very important, to be an innovator, not only to do your job. Can you give me an example? I'm not able to understand, we are not able to understand everything in your field, but maybe if you can try to describe us one or two techniques which made your job much easier and other doctors' job around the world, because I know your innovations are now well known around the world, not only in your hospital in Acibadem.
Sure. The scientists or the doctors, when we discovered or invented new things, we directly share this information with the scientific society in the congress or in journals, international journals. And yes, I mean, these around or over 20 inventions being published somewhere in the world, in the journals, medical journals. So because of this, other colleagues now from other countries been using my techniques. It's difficult to make some selection among them, but let's start from the last one, for example. Yes. Facial transplantation became a very, popular technique in last decade, and in every year 4 or 5 new cases reported from different countries.
We are talking about heart operation, about complex cases with accidents happen to the face, so you need to reconstruct the facial part.
But sometimes they say there is no solution to make a new face for this patient with his own tissues. And yes, we need transplantation, they say. And for example, the last invention was about autogenic reconstruction of total face. Again, I mean, a new face completely, without transplantation, without taking the face from another person who died. Just using, the patient's own tissues, bones, skins, cartilage, mucosa, everything, fat. And I showed that it's possible to create a new face. For example, to create a nose is always a challenge for a plastic surgeon. And we usually do use the forehead skins turn. We call it Indian flap. But sometimes, for example, in Alex too, there is no local skin to use. There is no local solution. Everything. Yeah, all just I'd say destroyed. So you should find other donor sites, other sources to harvest skins, tissues, subcutaneous tissue. And for example, can you imagine a nose or eyelids includes 3 layers, skin, cartilage, and mucosa. And we recreate these layers again. For example, there is one patient, and I didn't publish it. I recreated the nose on the head and transferred lately to the nose. If you lose some parts of your body, usually the lost part of this puzzle is hidden somewhere in your body again. So, and to find it is my job. And they call it invention or miracle. By the way, may I tell you one thing? I know that Romanian people and Turkish people who is following this story of Alex, is waiting kind of a miracle. In my sphere, in my job, in my profession, there is no miracle. But there are miraculous results. And to provide a miraculous result in plastic surgery is possible only with patience and working hard. And all of us should know how to wait. For example, people are asking photos of the last operation or the results of Alex in a week. It's of course impossible, to show something.
You will need years and many operations to reconstruct.
Believe me, it's first time for my career that I'm announcing an operation before I did it. Usually I complete, I guarantee the result in the best way, and then I share with the community and the public. Alex boy will be a very special man in that world, believe me. Now he has lots of difficulties, but at the end, we will see him. He will turn to be a very special man.
I understood you will be able to reconstruct his ears, for instance, when he will be around 7 years old.
Yeah,
So
reconstruction of an ear or making a new ear for a baby who was born without ear or who lost the ears because of burn or accident, is my job again. I have invention of this case too. And lots of patients coming from other countries to Turkey, to Bodrum for ear reconstruction. We use the patient's own ribs, cartilage from the chest wall. So, and to make any ear, external ear, we need a certain amount of cartilage. But under age 6, the size of chest is too small to provide that amount of cartilage. So we have to wait till 6 at least. And plus there is one difficulties about Alex's case. The skin over the ear area is burned completely, destroyed. So first we should provide a skin coverage and then ear reconstruction. We have lots of things to do about it.
How you support, please, how you support such a case, such a difficult case in Acibadem from the psychological point of view? Because these kind of hard cases needs full support in this area.
Acibadem group has lots of hospitals located different countries and different regions of Turkey.
And also there is Acibadem University, where the medical staff learn special techniques to work after in Acibadem hospitals.
And the level of our education is proudly saying highest in the world, I can say. We are using robotic, technology, and we have simulation labs that you
Even
can.
for the students, I was in university and I saw how the students.
You visit there.
Yes, of course. How they are learning, it's really great and it's really unbelievable. I saw they are using techniques only NASA use, for instance, to train their specialists.
Quite similar.
Exactly. Yeah.
We call high-tech educational system, and proudly we are providing our students like that. And at the end, they serve human beings. They serve us, so they should learn perfectly, without any deficit. So,
if you think to the future, what is a challenge for you?
my next dream is, getting me, I'd say, smaller by smaller every day, because I'm focusing on the, I'd say, cellular technology, cell things. Not the body, but producing something, some missed parts. Using cell cultures and stem cells. Fortunately, we have good labs in Acibadem again to achieve this aim.
Why somebody should choose to come to Bodrum, to Acibadem Bodrum, to make those operations and not, I don't know, in Europe somewhere?
Okay, sometimes to speak humble is a very good way. To be humble as a person, I'm trying to be. But as a profession, I cannot be humble because I'm the best about something in the world. Not in Turkey, not in Europe. Yes, it's not a saying. I did it. And
demonstrate it. Or
yeah, and I'll do it again. Another thing about invention, you ask about inventions,
yes.
Yeah. One more example. From one ribs, I recreate total understructure of a nose, and I named this technique ART, anatomic replication technique of Mutaf, and it's published in America again. Or another example, I wrote 3 different things for penile reconstruction. Or another example, we say challenging huge tissue defects on the body or face after cancer resections, cancer surgery. About 10 years ago, it was not possible to cover that big defects without using skin grafts. But now, because of some 3 closure techniques that I described, reading man, triangular closure techniques, spider procedures, all published in American journals again, it's very possible to recover this kind of defects. And plus, I invent to make bigger lips for cosmetic surgery without filler.
Oh, how is this possible?
Yeah, it's possible.
I'm not interested, to be honest, but I know a lot of people around me who
it's not about
are interested by this.
But it's about a clever way of thinking. There is always a way to achieve your aim if you think on it. If I make your eyebrow elevation or eyebrow lift, it will survive forever, because M lift is another invention that I made 2006 and now patented and used in America too.
Also, you have a great team there, because if you are a great doctor but you don't have a great multidisciplinary team, you cannot do everything alone. It's clear.
Never ever believed one-man show in medicine, in surgery, in health service.
A leader without his team it's not a leader, in fact, isn't it?
A leader should educate the team, motivate the team, and should give them every day a new challenge to be better and better by time.
As I saw, there are many people coming to Bodrum in a holiday,
yeah,
and using this time, part of this time, also to come to make a tiny aesthetic surgery,
sure,
or intervention, not necessary to be surgical, exactly. So I think this is very smart to combine your
way of holiday. Vacation is a time, free time to make ourselves refreshed, and after a vacation, when you came back to where you live, to home, everybody should say that, oh, you look better, or you are shining, huh? Bodrum is a center of tourism, very well known in the world, but now something changed about Bodrum. Now it's city of beauty and health.
I agree.
And we are providing not only surgical beauty procedures, but we are providing medical aesthetic procedures, again with high technology. And there are lots of people around different countries, around the world, coming, just a couple of hours. Later they continue their holiday or summer vacation, but after vacation, yeah. Everybody sees something different on their face or body or soul at the same time. Because I do believe that beauty is, helping to feel better inside. Yeah.
I want to ask you the last question now. you came now to Bucharest to see some patients here. I
Yeah,
really
last night
appreciate.
I came.
Yes, I really appreciate that you put your time and your experience in this project to help Romanians who cannot go immediately to Acibadem. And I want to ask you what kind of cases you dealt with today.
Today. Okay, of course. Actually, we can speak about a wide spectrum of patients. There was a breast reconstruction case, or maxillofacial surgery case, TMG joint problems, or kids born with huge hair nevus, or burn patients again, and cancer of maxilla. One old lady came up with her son, and tumor also.
I really want to thank you very much. It was a real pleasure to share with you those information. And it's not only about this, it's about your beauty as a person inside you. And thank you very much for being with your soul near the patients, not only with your techniques. Take care of you.
It's my
be
pleasure.
healthy,
Okay.
because we need to be healthy with your help. So we need you healthy.
I'm always around of you, anytime when you need and your nation needs me. But I'm so, I would say, desperately not hopeful that I'll be your doctor, because you don't need it.
Thank you very
You
much.
seem that for long years, I will not earn your money. Huh?
Thank you very much. I will go happy at home now.